Welcome to Part 1 of the Patient and Family Advisor Orientation video series, Patient and Family Advisors in the Changing Culture of Healthcare. In this video, we'll discuss the change from a paternalistic healthcare model to a patient and family-centered care model, the basic principles of patient and family-centered care and patient experience, and ways that patient and family advisors help to make positive changes in healthcare. The field of healthcare has changed a great deal over the years, with major advances in technology and treatment. Perhaps equally as important, the roles of patients and their family members and the ways they interact with healthcare professionals has also changed. Let's take a look at a couple of scenarios to learn more.
Good news, Mrs. Hughes. There's a new medication we can try for your hypertension.
Hypertension?
Yes, 135/90. Your blood pressure numbers are a bit high. I'll call in the prescription.
Could I just try to cut out the salt instead of taking a pill?
Diets are hard for most patients to stick to. I think medication is the best option for you. You should start taking it right away to minimize the risk of stroke.
Stroke? No one told me I was at risk for a stroke.
In the interaction we just saw, the physician gave the patient a diagnosis of high blood pressure and went on to prescribe a new medication to treat it. Did you notice the doctor didn't give the patient the chance to talk about her concerns about taking the medicine or ask her about her own preferences? This is an example of the paternalistic model of healthcare, where patients and family members have a care plan designed for them by a healthcare provider. They participate very little or not at all in making decisions for their own care. This type of doctor-patient interaction can result in patients not following through with a treatment plan because of confusion, and patients may feel the doctor didn't listen to their concerns. All of this can be equally frustrating for healthcare providers. For these reasons and many others, healthcare organizations are moving away from the paternalistic model and toward a patient and family-centered model. Now let's look at another example and see how it compares.
Your lab results just came back, Mrs. Rodriguez. Your blood sugar is a little high, what we call prediabetes. We need to decide together what to do about it. I think there are two good options here. We could try changing your diet and having you start an exercise program, or we could try medication. What do you think will work best for you?
I really don't like taking pills, and I know I could be eating better.
So it sounds like you'd like to try the diet and exercise road. Is that right?
Yes, I think so.
Okay, I'll refer you to a dietitian to help you with food choices. Do you have someone who can help you get started with exercise?
Yes, there's a gym I'd like to try out.
Wonderful. I'll get you that referral, and we'll see you back here in 3 months. Does that sound okay to you?
Yes, that sounds good to me.
Notice how the doctor explained the treatment options to the patient and asked her about her preference, rather than make an assumption about what would be best for her. This is known as shared decision-making, and it's consistent with a patient and family-centered care model of healthcare. This approach has benefits not only for the patient, but for providers as well, because patients are more likely to follow through with a treatment plan they helped create. They're also more likely to feel that their concerns were heard and taken seriously. The patient and family-centered care model is based on the idea that patients receive the best care when they, along with their family members, are invited to work as partners with their healthcare providers. There are 4 principles of patient and family-centered care: respect and dignity, information sharing, participation, and collaboration. We'll look at each one of these in more detail. Each patient is a one-of-a-kind individual who has his or her own combination of cultural backgrounds, religious beliefs, values, and personal preferences. Healthcare professionals who treat patients and family members with respect and dignity listen to and honor their unique perspectives and choices. Patients and family members need information to make the best decisions for their care. The principle of information sharing instructs that healthcare staff should communicate and share information with patients and families that is accurate, timely, unbiased, and complete. The third principle, participation, says that doctors and other healthcare providers should encourage patients and loved ones to participate in the patient's care at the level they choose. This helps to ensure that patients and family members have a more complete understanding of the patient's condition and treatment. Recognizing that people are different and have their own thoughts and preferences for participating is an important part of this principle, as some patients and loved ones will not feel comfortable being heavily involved in their care. The principle of collaboration supports partnership with patients and caregivers at the institution level. This means that patients and community members may partner with leaders and staff members on projects that impact a single department or the entire organization. Examples might include developing programs for patients or volunteers, helping to design new waiting spaces or patient care areas, helping to educate healthcare professionals, and giving input on how care is delivered. Together, these principles of patient and family-centered care provide a model for partnership between healthcare organizations, healthcare providers, patients, and their loved ones. As a patient and family advisor, you're helping the hospital become more patient and family-centered. Now that we've reviewed patient and family-centered care and compared that approach with the paternalistic model, let's take a look at another important focus in healthcare today: patient experience. The widely accepted definition of patient experience can be seen here: the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. This is a recognition that the thoughts and beliefs that patients have about a healthcare organization and the people who work there are influenced by a lot of things, from the conversations they have, to being able to find their way around, to the quality of the food. The experience is what people will remember about their time in the facility. In general, whether they're patients in a hospital, clinic, or doctor's office, people want to be treated with respect, to have their needs taken seriously, and to be treated like a person instead of like a condition or a set of symptoms. Because so many things go into creating a good experience for all patients and visitors, healthcare leaders and staff focus their efforts in many areas. That means, as a patient and family volunteer, you may have the opportunity to work on many different projects. Now that we've discussed the changing culture of healthcare and why patient and family-centered care and patient experience are so important, let's talk about how you might contribute as a patient and family advisor. As a patient and family advisor, or PFA, your role is to offer your insight and perspectives as a patient, caregiver, or community member. Your insights are based on your direct experience with receiving care in the facility or with caring for someone else who has received care. By sharing your experience and perspectives, you can help hospital leaders and staff learn how to improve care and how to offer services that patients and family members want and need. Partnering in this way is an example of collaboration, one of the 4 principles of patient and family-centered care we discussed earlier in this video. It is important work for helping to improve the patient experience for everyone. It also has many benefits. Collaborating with PFAs is beneficial for the organization because leaders and staff learn about the lived experience or what it is like to be a patient or the loved one of a patient. In turn, the organization is better able to create programs and policies that are responsive to the needs of patients and family members. Partnering with patients and caregivers can also be motivating for staff members who feel inspired by the stories they hear and are often grateful that volunteers in the community are willing to help them find solutions to challenges. Serving as a PFA is also beneficial for patients, caregivers, and community members because they often feel a sense of empowerment and fulfillment. Many PFAs see their role as an opportunity to make a positive difference in healthcare and a chance to give back. Patient and family advisors also have unique access to educational opportunities and the chance to learn how healthcare works from the inside out. So as you can see, serving as a patient and family advisor is important work. By sharing your perspectives and ideas in the spirit of collaboration, you're helping to improve the patient experience. Thank you for everything you do.